Hi, everybody. Today, the question that I am answering is why do old people refuse to go to the doctor? Your elderly parents, your grandparents, your loved ones. This is such a frustrating problem for caregivers. If you are a family caregiver, you may already be struggling to convince your parents or grandparents or somebody else to go to the doctor because they're having health issues. So why don't parents go? Why don't grandparents want to go? Feeling uncomfortable going to the doctor can result from having a previous bad experience. And then on the other hand, it can be fear of having a diagnosis that turns into bad news. How many of us want bad news? I don't know anybody who wakes up on any given day and says, wow, I hope somebody gives me bad news today. I hope I get information that I don't like. These are all reasons that your elderly parents don't go to the doctor. So in this video, I'm going to share insights about both of these topics to help you understand a little bit more about where your elderly parents or grandparents are so that you can talk to them about the importance of going to the doctor to avoid their health from getting worse. They can be proactive. They can solve these things before they get to a point where they're really a bigger problem than they have to be. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there, a lot of hopeful tips, information for caregivers and aging adults. And if you're watching this on my YouTube channel, there is a new playlist that family caregivers have been asking me for. It's called Caregiver Education Programs. And on there are very detailed videos, webinars with a lot of specific information to help you care for elderly parents, yourself. So please check that out. Also, press the like button, press the follow button on this channel so that other people who are looking for hope, help, and caregiving support can find it. So let's get back to why older people refuse to go to the doctor and how you can help your elderly parents get the medical care that they need. So first of all, if your parents are over age 85, there can be cognitive issues going on like a little bit of memory loss, and that can result in just confusion and forgetting about the importance of medical care, not wanting to go see a doctor, but then way on the other hand, do your parents know anybody who has dementia or Alzheimer's? And they're watching this person's health get worse and they're scared to death that that might happen to them. Fear of a memory loss diagnosis, dementia, Alzheimer's, something else, is a huge reason that older people don't want to go to the doctor. So beyond that, it could just be fear of a diagnosis of any kind of health issue, or having an issue with a doctor where your parent has gone before and the doctor just didn't listen to them, ignored their needs, maybe couldn't help them. Well, maybe your parents have the wrong doctor. Maybe they need to change doctors. Maybe they need to find a doctor who takes a personal interest in them and their health. Now, if you're young and healthy, if you're a caregiver in your 20s, 30s, 40s, 50s, even 60s, and you don't have a lot of health problems, it can be really hard to identify with how your parents feel every day. They don't feel well, they're tired, they're exhausted. Think about this. How many older adults over the age of 70 or even 80 do you know who are healthy, physically able? They are living the life of their retirement dreams. I can probably guess and say that you don't know too many. Well, why is this? It's because there's no education about being healthy when we're young. We're young, we're healthy, we don't think about it, we do all these things, then all of a sudden we have these parents that we have to take care of and they're sick. So other reasons that your parents may be hesitant to go to the doctor is they may be seeing their friends, older friends, younger friends, become diagnosed with dementia, Alzheimer's, heart disease, diabetes, COPD, arthritis. And they're looking at their friends and saying, oh, that does not look good. I don't want to be like that at all, right? And you're not like that until you go to the doctor and the doctor says, well, you have high blood pressure, you have clogged arteries, your cholesterol's high, your triglycerides are sky high. your blood sugar is making you sick. It's kind of the reality of going to the doctor and getting that slap in the face that says you have a health problem that now you have to deal with. So here's the thing. This is the bright spot in all of this, okay? For people who can push themselves to be a little uncomfortable to go to the doctor, no matter what your age, 20, 30, 40, 70, 80, being proactive and going to the doctor when you have a little ache or pain or when you don't feel well can mean that you can get a very early diagnosis, which then means you have this huge opportunity to avoid that diagnosis from getting worse and worse and worse and worse until it really becomes such a problem that you can't go back and fix it. It's kind of like having a car. You hear this noise in your car and you think, wow, I should get that fixed. But you're like, well, my car's still driving. I'm not going to do anything about it. And then all of a sudden you have this huge problem that happens. Your car isn't drivable. You've got a $5,000 repair where if you would have taken care of it 6 months ago, it would have been a $50 repair. The body is no different. The longer that you wait, the longer that you ignore health issues, the longer that you say, oh, I'll get better, my body will heal itself, the longer that you are in denial, the more likely it is that you're going to come to a point where you can't backtrack. You can't fix the problem. Why would anybody want to have a health problem that they can't fix? It's because they're afraid of a diagnosis that really may not be anything big. The fact is that older adults who wait to investigate these health issues have lower survival rates from serious diagnoses. They may experience a lot of unnecessary pain and suffering. So in talking to your parents about why they won't go to the doctor or your grandparents, get down to the issue and say, Mom or Dad, what are you afraid of? The benefits of getting a diagnosis early can make all the difference. Let me go to that appointment with you. Let me talk to the doctor for you. Let me ask questions about the diagnosis so that we know what we're dealing with. We know what we can do. We know what we should do. So if your parents are continually resisting, how do you know if the issue is serious or not? Well, one indicator is repeated issues with one or more health issues that have them not feeling well. So if your mom or dad is always having heart palpitations, or they're tired, or they're exhausted, or they're constantly in and out of the hospital, those are issues that really are not going to get better, and you want to get control of them. You want to understand what's going on so that you can choose what to do or not to do. And so if this is happening, their primary care doctor may or may not be the right person to talk about it. So if it's heart disease, go see a specialist, see a cardiologist. If it's diabetes, see an endocrinologist. If it's breathing issues, see a pulmonologist. The value of specialists cannot be underestimated because sometimes there are things that general doctors just don't know. That's not their specialty, right? So beyond this, though, as the caregiver who is taking your parents to the doctor, you want to be extremely, extremely proactive. Ask about the diagnosis. What are the consequences? What happens if we do this or don't do this? What medications are available? What should my parents be doing? So that you have all of the information right in front of you so that you can help your parents decide if they want to make better choices and change their lifestyle and habits, or if they want to say, you know what? I'm not going to do anything about this. This is what is going to end my life. I'm going to go on comfort care. I'm going to go on hospice care. And that's just the way that it's going to be. So most of all, what can caregivers learn from this? We can learn that being afraid of going to the doctor, being afraid of getting a diagnosis can actually cause more problems when if you go early, you can be proactive, you can solve the issue. So I encourage you to face your fears, help your elderly parents and their your grandparents to face their fears about going to a doctor and about learning about health. There is so much that you can do, especially if you want to be that person who is 60, 70, or 80, and you're living the retirement of your dreams and you're in good health and you're active. Why not make that choice if you can? What does it take? It takes really having a desire to learn about how to be healthy and to become educated and knowledgeable. You have so many choices ahead of you if you have this interest. I'm Pamela D Wilson. My website is PamelaDWilson.com, and there's so much help on this YouTube channel. Check out the Caregiver Education Program playlist. A lot of detailed help for caregivers and aging adults who want to stay healthy and learn how to manage day-to-day care. I'll see you all again soon in another video. Thanks for being here.